people, Wendell, that are trying to then appeal to that union voter, the dad in Maria's scenario, who's like, I want to hold on to my union health care. Pete Buttigieg has been one of those who's been very aggressive about trying to say, hey, I've got something for you, which is his Medicare for all who want it. And you said this morning, you tweeted, you responded back to Mayor Pete's attempt to sort of grab that dad. And you said, I read this morning that Mayor Pete plans to attack Medicare for all for political gain in Nevada. This will thrill my old pals in the insurance industry, as Pete's plan preserves the very system that makes them huge profits while bankrupting and killing millions. And then you go on to explain why it was a tweet thread that was interesting. People should read it. But how would you answer that union member who says, we fought for 5 years to get this health plan. It's a great gold-plated health plan. Why should we give it up for nationalized health care?
Well, for one thing, the Medicare for all would make sure that anyone, even if they are in a union plan, would have absolutely coverage that is absolutely as good as what they currently have now. But they would also have security. One thing to keep in mind is that even if you have coverage and you have union representation, you still are subject to layoffs. Just last year alone, MGM Resorts in Las Vegas laid 1,000 people off. 28 million people in 2018 in this country were laid off. So it's not secure. Health insurance at the workplace is not secure. Plus, you're also subject to the whims of the insurance industry. When a doctor, for example, or a nurse at an insurance company says, we're not going to cover that, even though it's a covered benefit. And I'll tell you this story. In fact, one of the reasons I left my job is because of that kind of a situation. A lot of folks talk about having a Cadillac plan. There was a 17-year-old girl in Los Angeles who actually, her father worked for Mercedes, so she was in a Mercedes plan. She was scheduled for a liver transplant, but Cigna said they didn't think it was medically appropriate for Natalie Sarkeesian. She died 5 days before Christmas in 2007. Mm-hmm. That goes on every single day, and that was the reason I left my job. So people need to know that even if you have coverage in the workplace, the system is also crumbling. In 1999, we had 160 million people who had coverage to the workplace. Now it's down to 150 million. So, and in that space of time, the population increased 50 million. So it's not a stable or secure way to get your health care. And I think the Medicare for all is resonating because people understand that.
But Joy,